Wondered why high blood pressure is often referred to as the silent killer? This name isn't given lightly. High blood pressure, or hypertension, is a condition that stealthily affects 1 in 3 adults worldwide. Despite its prevalence, it's a condition that often goes unnoticed, quietly damaging your health. The danger lies in its subtlety. High blood pressure seldom presents with clear symptoms, making it easy to ignore, easy to overlook. It's like a thief in the night, slowly and silently wreaking havoc on your body, leading to severe complications like heart disease and stroke if left unchecked. So why is it that so many of us remain blissfully unaware? It's because high blood pressure is an insidious condition. It doesn't shout, it whispers. And that whisper can be deadly if not detected and treated in time. Now that we understand the gravity of this condition, let's delve into the various clinical conditions that can cause high blood pressure. So, what exactly triggers high blood pressure? High blood pressure, or hypertension, isn't an arbitrary condition that just pops up out of nowhere. It's often the result of underlying health issues or certain lifestyle choices. Let's delve into some of the clinical conditions that can lead to high blood pressure. First off, we have kidney disease. The kidneys play a crucial role in controlling blood pressure by regulating the amount of fluid stored in your body. When the kidneys aren't functioning properly, they can't remove excess fluid, leading to an increased volume of blood. This, in turn, can cause your blood pressure to rise. Now let's move on to hormonal disorders. Conditions like Cushing's syndrome, hyperaldosteronism, and thyroid disorders can all lead to high blood pressure. These disorders cause an imbalance in the hormones that regulate blood pressure. For example, in Cushing's syndrome, the body produces too much cortisol, a hormone that can raise blood pressure when present in high amounts. Even certain medications can trigger high blood pressure. Non-steroidal anti-inflammatory drugs, birth control pills, and decongestants are just a few examples. These medications can increase your blood pressure by causing your body to retain more sodium and fluid, or by causing your blood vessels to narrow. But it's not just clinical conditions and medications. Lifestyle choices can also trigger high blood pressure. Consuming too much sodium, a lack of physical activity, smoking, and heavy alcohol consumption can all lead to hypertension. So you see, high blood pressure isn't a standalone condition. It's a symptom of a bigger picture, a sign that something is not quite right in your body. And while we can't always prevent these clinical conditions, being aware of them and understanding how they affect our blood pressure is a step in the right direction. It allows us to take proactive measures, make healthier choices, and seek timely medical help. As we've seen, high blood pressure can be triggered by a variety of clinical conditions, but how can we manage it? Managing high blood pressure often involves lifestyle changes and medication. But what kind of medication? Now that's a question many of us have wrestled with. Several medications can help in regulating blood pressure. Let's talk about a few. First, we have diuretics. These are often the first line of defense, helping your kidneys flush excess sodium and water from your body, reducing the volume of blood they need to pump. Then there are beta blockers. These medications work by slowing your heart rate and reducing how hard your heart has to work, which lowers your blood pressure. And let's not forget about ACE inhibitors. These drugs help relax and widen your blood vessels, making it easier for blood to flow through. Remember, the choice of medication often depends on the underlying cause of the high blood pressure. Your healthcare provider can guide you through this process. While medication can help manage high blood pressure, it's also important to maintain a healthy lifestyle. So what should we remember about high blood pressure? High blood pressure, often referred to as the silent killer, is a serious health concern that should never be taken lightly. It can lurk unseen, causing significant damage before symptoms become apparent. Triggers of high blood pressure are manifold and can range from certain clinical conditions to lifestyle factors. These include kidney disease, hormonal disorders, or simply an unhealthy diet and lack of exercise. It's critical to be aware of these triggers, as understanding them is the first step towards management and prevention. Treatment is not a one-size-fits-all approach. It's tailored to the individual and the underlying cause of their high blood pressure. Medication is often necessary, but it's just one part of a multifaceted treatment plan. Lifestyle changes, regular checkups, and constant monitoring also play a vital role. Remember, knowledge is power when it comes to managing high blood pressure. Stay informed, stay healthy.